Let's focus first on the national capital. Delhi Chief Minister Arvind Kejriwal has in fact reiterated that he will follow the Lieutenant Governor's order with regards to opening up the capital's hospitals for non-Delhiites as well. In a press meet, Kejriwal, however, warned that cases in the capital is only going to rise. The Chief Minister said that Delhi will in fact witness 1 lakh cases by June and about 5.5 lakh cases by July. He said that normally 50% beds in Delhi hospitals are used by patients in the state. Hence, the corresponding demand for beds will double as well. He's in fact said that 1.5 lakh hospital beds will be needed in Delhi to meet the demand. The capital will now follow Mumbai's example and convert several stadiums as COVID care centres. Raising beds may prove to be a Herculean task because Delhi currently has just 8,821 hospital beds, 582 ICU beds, 468 ventilator beds and 3,590 beds with oxygen facility in COVID hospitals. The state government is also linking big hospitals to 5 or 4-star hotels where the upper price cap will be 10,000 rupees per day per bed.
You see, this order violated the constitutional right to equality and right to life, which includes right to health. Earlier also a similar order of GNCTG was struck down by Honorable High Court of Delhi, double bench headed by the Chief Justice of Delhi, on the ground that no citizen of India can be discriminated on the basis of residence. When it comes to health care, access to universal health care is responsibility of the state.
केंद्र सरकार ने निर्णय ले लिया, एलजी साहब ने आदेश पारित कर दिया। ये समय असहमतियों का समय नहीं है, ये समय एक दूसरे से डिफर करने का समय नहीं है। अब जो निर्णय हो गया केंद्र सरकार का, एलजी साहब ने जो आदेश दे दिया उसको लागू किया जाएगा। एलजी साहब के आदेश को अक्षरशः लागू किया जाएगा, केंद्र सरकार के निर्णय को लागू किया जाएगा। अब इस पे कोई असहमति नहीं करनी, अब इस पे कोई वाद विवाद नहीं करना, अब इस पे कोई लड़ाई झगड़ा नहीं करना। आने वाले समय में दिल्ली में कोरोना बहुत तेजी से फैलने वाला है। 15 जून को उम्मीद है कि 44,000 केस हो जाएंगे, जो आज 31,000 केस हैं। ऐसा अनुमान है कि 15 जून तक 44,000 केस हो जाएंगे। 30 जून तक 1 लाख केस हो जाएंगे। 15 जुलाई तक 2.25 लाख केस हो जाएंगे और 31 जुलाई तक लगभग 5,32,000 केस हो जाएंगे दिल्ली में। 15 जुलाई को दिल्ली में 33,000 बेड्स की जरूरत पड़ेगी दिल्ली वालों के लिए। 31 जुलाई को 80,000 बेड्स की जरूरत पड़ेगी। दिल्ली के अस्पतालों में 50% लोग दिल्ली के बाहर से आके इलाज कराते हैं। 15 जुलाई को दिल्ली के वालों के लिए 33,000 बेड चाहिए, तो सारे मिला के बाहर वाले भी अगर मिलाएंगे तो 65,000 बेड्स की जरूरत पड़ेगी। और 31 जुलाई को 80,000 बेड अगर दिल्ली वालों के लिए चाहिए तो लगभग 1.5 लाख टोटल बेड्स की ज़रूरत पड़ेगी। बहुत ज़्यादा बड़ी चुनौती है, आसान काम नहीं है।
Anisha Mathur is joining us live from Delhi with more details on this. Anisha, the message from the Chief Minister is definitely reassuring because he says very clearly that there's going to be no politics over the issue of whether beds should now be reserved for Delhiites or not. He's made it very clear that the government will abide by what the Lieutenant Governor has said. Having said that, at the same time, he's also warned that cases are going to continue to rise in the national capital. So what really is the Delhi government strategy to tackle that and ensure that their healthcare doesn't really crumble?
Well, Akshata, the Delhi government, of course, is scrambling to get more and more beds set up, to get more and more COVID facilities set up. As the Chief Minister in his PC has also very clearly said that now hotels and as well as stadiums would be converted to COVID care facilities. We've seen this happening across the country, in fact across the world, that stadiums have been converted to COVID care emergency facilities. In the city also, hotels are going to be taken over to be connected to hospitals. Kejriwal, of course, has also warned of the sheer numbers, the staggering numbers that we are possibly looking at. The estimates are showing the kind of numbers that we are possibly looking at: 45,000 in the coming 5 days itself, and more than 5 lakh in the next month. And that is the kind of numbers Delhi is looking forward to as more and more people are coming out. What is interesting, however, is now Arvind Kejriwal, after almost 48 hours of serious war of words between his government and the LG, has now said that now that the LG has passed his order, there cannot be any more politics. There should not be any politics. Whatever the LG and the centre have decided will now be implemented. So therefore, people from outside will get beds in Delhi, and it is now for the Delhi government to consider how exactly they're going to cope with the sheer numbers.
So it's a great message that's come in from Kejriwal. He's maintained that there's going to be no politics or bickering over the LG's decision to overturn the Delhi government's order, and he's maintained that the AAP government will follow it and ensure that they provide beds as well. Anisha, thank you for joining us.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.